Hi everyone, Namaste. My warm greetings to everyone listening to this podcast today. A warm welcome again to a special episode of Medicover Health Talks. I, Dr. M. Srujna Devi, Consultant Anesthesia and Medical Superintendent for Medicover Hospitals, Visakhapatnam. So today it is a very special episode because it is the most common yet most preventable endocrine disorder, that is diabetes. So we want to welcome our chief guest, our one and only Dr. Vamsi Krishna sir, leading respectful endocrinologist of our Medicover Hospitals, MVP Vizag. Sir, welcome to our podcast. Why this day is being celebrated as a diabetes day, sir?
A good question. The thing is, insulin is one molecule which has revolutionized the management of type 1 diabetes and many of our type 2 diabetes. In fact, Frederick Banting and Best are credited with the discovery of insulin, which has revolutionized the management of type 1 diabetes. And in order to improve the awareness of diabetes,
Thank you, sir. Very well explanation. Very nice elaboration, sir, for sharing your inspirational insights. What is the theme? Can you explain us? And is there any significance to it?
so in order to improve the awareness of diabetes, every year there is a specific theme. This year theme by IDF is diabetes and well-being with special emphasis on diabetes and workplace. As you all know, diabetes is a chronic condition with its effects on the physical well-being, mental well-being, and also in many places they face these problems in the workplace. And majority out of 7 out of every 10 diabetes are young and they have some problems or discrimination in the workplace. So, in order to improve this physical well-being, mental well-being, and occupation well-being, this year the theme has been revised and with special emphasis with regard to the work environment. So, in order to follow proper diet, lifestyle to have proper physical well-being, and many of the diabetic people or people with type 2 diabetes or people with diabetes have some social and mental problems like anxiety, depression, and also they face a lot of problems in the workplace. So we need to be empathetic with them, let them share their problems, be a part of the problem, and let's find a solution even in the workplace.
Very well said, sir. It's beautiful. Like it's not for only the older age people. Now we are going to say it is across all the life stages and especially the workplace. And in recent times, the workplace is being very much stressful with lot of hours being burnout and people getting more stress on their mental health. So it is not just about physical, it is about the mental health as well as the occupational well-being you have explained, sir. It is very great. Explanation. So now I want to ask you, so what is this word diabetes? What is diabetes? What are the types of diabetes? Any special classification? And what is gestational diabetes mellitus? Can you explain us, sir?
So diabetes, the complete term is diabetes mellitus. It is nothing but increased blood glucose. We have a criteria, fasting blood glucose of more than or equal to 125 mg per deciliter, 3 months average, which you commonly known as HbA1c more than or equal to 6.5, or a blood glucose 2 hours post 25 grams glucose, a value of more than 200, or a random glucose irrespective of the meal more than 200 along with signs and symptoms of diabetes is defined as diabetes mellitus. So, regarding the signs and symptoms, many of the people come with unexplained weight loss, extreme weakness, increased urination, extreme weakness. So, whenever you have these signs and symptoms, you need to screen them for diabetes mellitus. Majority of us, in fact, you can see diabetes across all the age groups, right from newborn even to any age group. The reasons are multiple. We'll be elaborating in the next few minutes. So whenever you have these diabetes, consult your local endocrinologist, get screened by for the presence of diabetes mellitus, and then we need to treat them accordingly.
Great, sir. Very well said regarding the pre-diabetes, diabetes, and it can affect at any age group. So, screening and getting investigated and treated is very important, like our sir has said. So, anybody in your family members or you itself are suffering from any of these symptoms, as well as any of these investigations, kindly bring to us and get treated by our endocrinologists. Yes, sir. So, Could you explain us what are the warning signs and symptoms of diabetes? In childhood, we have read easily like 4 P's, the polyphagia, polydipsia, polyuria, and polyneuropathy. So what are the warning signs and symptoms? What are the complications? How did you diagnose it? And how did you treat the patients who came to you, sir?
So the symptoms depends on the severity of the blood glucose. So in children, especially, this diabetes mellitus goes unnoticed. They present to us with severe weight loss, increased urination, extreme fatigue. Sometimes they do land up in diabetic ketoacidosis, that is a very high blood glucose and presence of ketones in the blood and urine, leading to breathing issues and sometimes unconsciousness. So whenever any children has any of these symptoms, you need to consult a pediatrician or an endocrinologist, get screened and treated accordingly. Otherwise, adults, they can present with simple weight loss, or in fact many people go unnoticed. This is known as the iceberg phenomena, where majority of people have a high blood glucose but they do not have any signs and symptoms. So anyone, we do have a criteria when to get screened. Anyone having any risk factors like obesity, hypertension, dyslipidemia, or strict family history or any ethnicity, especially we Indians, Southeast Asians are very high risk of type 2 diabetes. So I would suggest anyone above the age of 30 years to get screened at least annually. And also many people nowadays are coming with any genital fungal infections, any shoulder pain, that is frozen shoulders. So whenever you have any of these symptoms, get yourself screened so that you can catch the problem early and get better treatment.
Yes, sir. Very well said. It is an eloquent explanation by you. Yes, we do have the silent symptoms sometimes. We don't know. There are no symptoms from the patient, but still there will be the investigations. Your blood sugar levels will be on higher side. It may be in the childhood also, like the sir has explained. So never neglect it. And you have to be screened, like sir has said, in particular age groups, especially after 30. If you're having any family history, genetic disorders, as we have more ethnicity, even any fungal infections in the genital areas. Very well said, sir. Great points. Now the people are aware, like what are the symptoms, or even if it happens in a silent way in all the age groups, they will get screened and get investigated and can be treated fast. Yes, sir. So now I want to ask you regarding the treatment of diabetes. How did you treat your patients with different kinds of symptoms and complications? How did you manage the patients, especially this DKA patients and HONC patients also you get? Any recent advances or guidelines regarding the treatment of diabetes? Kindly elaborate us, sir.
So basically, the treatment of diabetes depends on what exactly is the cause of diabetes mellitus, what exactly is the presentation. For example, in type 1 diabetes, where there is absolute insulin deficiency, the treatment of choice is one and only insulin. So if it is a DKA, we treat the patient in an ICU, give them IV fluids, IV insulin, gradually discharge them on insulin. We commonly use the basal bolus regimen 4 times a day. Or now we have the recent advances in the form of insulin pump, where it is combined with a CGMS. It is known as a closed loop. Next, coming to type 2 diabetes, again it is basically insulin resistance. We need to break the insulin resistance through diet, a good lifestyle, a good dietary modification, and drugs as necessary. Earlier, we used to have 2 or 3 medications for type 2 diabetes, but now over the last a decade or two, we have many medications. So basically depends on the presentation. Any infection in even type 2 diabetes, we again go for insulin temporarily or during surgeries, any stress, any issues like heart failure or admissions in the hospital, we go for insulin. Otherwise, we have many options. Basically, the newer treatment options are GLP-1 receptor based therapy as well as SGL2 inhibitors, along with the gold standard metformin, sulfonylureas. So even in a resource poor setting like India, we still continue to use sulfonylureas, metformin. We use all the newer drugs like DP4 inhibitors, SGL2 inhibitors, and then over the last 3 to 6 months, we have 2 new injectables, that is injectable tirzepatide and semaglutide. The main benefit with these molecules is a significant weight loss of up to 10 to 20%. And all the studies have shown that these drugs like SGLT inhibitors or a GLP-1 receptor based therapy, they have very good benefit with regard to the CV outcomes and also with respect to the kidney outcomes.
A very great discussion, sir. Very well said. The treatment and the recent advances for the diabetes, like he has explained and classified all the different kind of drugs which we use today and all the recent advances. These both things which are causing significant weight loss in diabetic patients. So many people want to listen regarding this weight loss as well as diabetes. He has explained very beautifully, sir. Thank you for that, and congratulations for treating many patients with all these kinds of symptoms with your recent advanced treatment in our Medicover hospitals. So today I want to ask you regarding what are the types of diabetes we have. We easily say like type 1, type 2 kind of diabetes. Is there any other classification, or this classification can you elaborate us and explain what is happening in this type 1 and type 2 diabetes, sir?
So it's a very important question regarding the types of diabetes. See, not all diabetes mellitus are the same. The main two types of diabetes are type 1 diabetes and type 2. Type 1 is mainly autoimmune, which is autoimmune destruction of the pancreas leading to insulin deficiency. Mainly seen in onset is seen in children, but it can occur at across any age group. So type 1 diabetes is insulin deficient, where we treat with insulin. Type 2 is mainly seen in adults. It can be seen even in children because of poor lifestyle, increasing obesity. So type 2 diabetes is because of insulin resistance. Then we have the other types of diabetes like monogenic diabetes, where we have this neonatal diabetes or the MODY, or because of any exocrine insufficiency of the pancreas leading to pancreatic damage leading to pancreatic diabetes. Now we have many drugs like even steroids can cause hyperglycemia. Many genetic syndromes can be associated with diabetes. And then we have the gestational diabetes, where there is hyperglycemia onset in the pregnancy. This is known as gestation diabetes. And then there's a new type of type 5 diabetes, which is seen mainly in lean adolescents and young adults because of malnutrition. This is a new entity which has come up in the last 1 year. Again, these are insulin deficient. Again, a majority require insulin in type 5 diabetes.
Great, sir. Very well explained regarding the different types of diabetes we have, along with the recent classification. So diabetes is not only about type 2 diabetes mellitus, so we also have the type 1, any issue with your pancreas and insulin resistance, autoimmune diseases, and sir has explained regarding the malnutrition, the gestational diabetes mellitus, which we see in the pregnant women. So today our people can understand the classification, and it can occur at any age with different kinds of risk factors as well as the genetic issues they are having, sir. So we want to ask one more question, like, is diabetes remission possible? Can you explain us if it is possible?
This is a very hot topic about diabetes remission. Thing is, if you ask me the question, the answer is yes. Mainly depends on what type of diabetes you are treating, what exactly is the age, the duration of diabetes, and the weight. Whenever you talk of remission, it is type 2 diabetes. So in type 2 diabetes, we have various studies which have shown whenever you achieve a good weight loss of around 5 to 7%, remission is always possible, and a higher weight loss, especially in obese individuals with BMI more than 35, there are very high chance of remission. So to go for remission, you need to have a good lifestyle, good dietary changes, achieve a good weight loss, and use of newer drugs like, which I already mentioned, tirzepatide, injectable semaglutide. You can achieve a good weight loss. We have seen people getting off multiple tablets after using this, achieving a good lifestyle and a weight loss. Another good option is a bariatric surgery. There are various bariatric surgeries available, and depending on the baseline BMI and the type of bariatric surgery which you have used, diabetes remission is always a chance. But even after getting a remission, the thing is you need to maintain that ideal body weight, a good lifestyle, a good nutrition. So whenever you are able to take off the drugs and have a good HbA1c of less than 6.5 for a period of 3 months, it is defined as remission. But as soon as you stop all the lifestyle measures, again, a relapse is always a problem.
Very well said, sir. With all recent advances, he has explained whether it is remissible or not. He is telling that especially in type 2 diabetes, it is possible. So diabetes is not just a medical condition, it is a lifestyle condition. So we have to see not only how there is an increase in your sugar levels, but how we eat, how we think, how we work, how we move, everything can matter. So this all can cause your lifestyle changes, so you can prevent it. And again, there might not be a relapse if you're following this kind of all this lifestyle modifications. Yes, sir. So, sir, today we want to summarize all the key points. What is the final message you want to give us on this 14th of November 2025, on this World Diabetes Day, to create awareness to our listeners?
The most important thing is have a good lifestyle. Eat properly, exercise regularly, prevent obesity. Prevention is always better, and this should start right from the schools. We need to educate them about proper diet, exercise, maintenance of ideal body weight, and even after getting diabetes mellitus, it is not the end. You need to see what type of diabetes mellitus you have, what are the available treatment options, consult an endocrinologist, and then get yourself treated. See, get yourself screened for any complications like any neuropathy, retinopathy, nephropathy, or any heart issues, any vascular issues, and then use all the drugs. Maintain blood glucose values in a normal range. Maintenance of blood glucose values in the normal range prevents all these micro and macrovascular complications. And then eat healthy, have a good body weight, and most importantly, any people with diabetes should not face any discrimination in the workplace. Be empathetic and give them moral and emotional support. Thank you.
Congratulations, sir. Very well said. Yes, so it is all the lifestyle modifications you have to do, and we see it should be prevented. You should not come to us for the treatment. If yet so, we are still here to treat you as fast as possible in our Medicover hospitals with our endocrinologist. So, all the lifestyle changes, your food habits, reduce your stress and your adequate sleep hours, have some exercise in a day at least 30 minutes, and have a balanced diet. So, both physical and mental well-being is important. Let us all together fight this diabetes, prevent it, stay aware, stay healthy, stay happier all the time, beating this diabetes. Signing off from today with M. Srijna Devi, consultant anesthesia and medical superintendent, Medicover Hospitals, and our pioneer, our leading endocrinologist, Dr. Vamsi Krishna, Medicover Hospitals, Visakhapatnam. Thank you.
Thank
You,
you.
sir.